Happy Easter.
Okay, so welcome to this week's call, everybody. My name is Jackie Boyle, and as always, I get the utmost pleasure and honour of being able to introduce a very good friend to all of us, Dr. Joseph Ahrens, dual-nominated Nobel Prize scientist. And, you know, each week we have Health Talks 365. What does that mean? We choose a topic and we get into the nuts and bolts of that topic and talk about what is it. And this week is about heart health and understanding how important the heart is for the human body, from gestational, from when you're a fetus through to right through different stages of your life, and how we may be able to support having a better health for our heart. But I do want to say before we get moving forward, this is just Dr. Ahrens' own personal opinion. We're not aiming to heal, cure, or mitigate any diseases related to the heart. And of course, if you've got any concerns, please seek out your own personal physician. Just want to make sure that we're compliant with that. So how are you, Dr. Ahrens?
I'm doing great. As you know, as I take a picture every Thursday right before I sit down and to go on these talks. And it's the same. It's just boring. Every week it's the same.
So you're really just having a go at us and telling us that it's just beautiful and we should be jealous.
Well, you know what? Do what you want. You can be jealous you want, but hey, I'm surprised when people find out I live in the Bahamas. They say, well, do you like it there? I'm thinking, why else would I be here? Nobody's forced me here. Okay, yes, I love it. It's fine. Although I've been to Australia before, as you know, in all places around the world, there are some spectacularly beautiful. I'm not trying to say this is prettier than anywhere else, but I like it here.
Well, Dr. Ahrens, before you get started, I must say, compared to you and Jim Lindemann, who's got snow galore out of his window, I think I'd rather be where you are. So I'm going to hand it over to you and let's talk about the heart, because the heart has so much, besides it being something that needs to function very well for us and efficiently, there is also emotional components to the heart as well. And so there's lots of areas. So I'm going to leave that in your scientific brain to be able to share that with us.
Well, thank you very much. This subject is very dear to my heart. I just had to say that. Well, the heart is centered to our lives. Even we could live without a brain, actually. You know, everybody's probably had people in their family like that where their brain's gone, but you know, you got to have a heart and lungs, and the two of those work together, because what's actually happening is you're trying to get oxygen to all the cells and get rid of the waste products and carbon dioxide. That's really what the heart is about. It's distributing oxygen and taking back some of the waste products, and also that's how you get your vitamins. And if you think about what that is, everybody say, oh, it's a pump, you know, it's just a pump. You know, it isn't surprising after all these decades we still don't have a mechanical heart. Wouldn't you think that would be such an easy thing? It's just, oh, it's just a pump. It's just, no, it's not just a pump. And we have not yet been able to have a mechanical heart. That's just so surprising. So what is going on about this heart? Let's talk all the way back to in conception. And that is, you get a couple of cells together, and then they start elongating this way, and they figure out an axis. And then they have a neural tube that grows, and then boom, the next thing happens is a heart. And it's just a couple of cells, but they start beating these cells. It's really interesting that if you take little cells out of your own heart, in an individual's heart, individual cells, whether there's 4 cells, 10 cells, or 100 cells, and isolate them, and you put them together in a test tube in a petri dish, they start pulsing together. at the same time. It's incredible. So something's going on here more than just some mechanics. And they have their own sense of what they should be doing. It's just a miracle of life. Eventually, as the body grows and this takes on a chamber, and then it actually starts pumping. And you know, some organisms have just one chamber. Some organisms have 5 individual hearts with individual chambers. That's an earthworm, by the way. They don't have like a heart like us. They've got 5 little pulsing centers that work together. But ultimately, it's just to try to get things flowing in your body. You know, an amoeba has no heart. An amoeba is the lowest life form that we can see that has organization, and everything works in there just by kind of flowing from just hot and cold, just like you stir sugar in a cup of coffee. That's how that amoeba works. Things just flow inside. But in us, higher life forms, even a worm, this heart is critical to distributing the fluids throughout the body. And what are those fluids? Well, we just said, of course, oxygen. Now that works in conjunction with the lungs. Lungs bring in oxygen and they expel carbon dioxide, but immediately go into the circulatory system, and it's the heart that's driving this. So number one, the heart is pushing oxygen and is taking out carbon dioxide. But also when you eat, you know, a lot of people don't grasp that point. Yes, they think heart and lungs, but then when you eat and you got food in your stomach and then in your intestines, the food that you've digested, all those chemicals and the flavonoids and vitamins and proteins, they get across that barrier and they go into the circulatory system. There's the heart pushing those things around. So many people just think about, you know, I'm short of breath and my heart's beating. Man, no, that's just a small part of the story. And then your brain is producing chemicals. It produces chemical signals to tell the rest of your body what to do, whether it's your adrenal glands and your liver and your pancreas or your gonads or anything. Those signals, they're pushed around by the heart. And then in turn, those signals tell the heart what to do. That's really pretty cool, because you look at the adrenal glands, which sit on top of the kidneys. That's what produces the epinephrine and the norepinephrine. Those are the chemicals that tell your body to fight, run, kick ass, get out of town. They're also the same ones that tell you to calm down. They sit on top of the kidneys. And it's your heart that distributes that signal around to different parts of your body and tells your lungs to start increasing and the heart itself to start pumping faster. So the heart is actually carrying its own signal. Okay, that's the general anatomy and how that works, the morphology. So what is it about heart health? What do you think, therefore, do you need to have a good, healthy heart? Well, you need to have a strong muscle. That muscle, it pumps. If you think about that thing, is beating 60 to 80 times a minute for your entire life. Any other muscle that you did that to would just wear out in just a matter of a few minutes or hours, constantly beating. And it beats, as I said earlier, of its own accord. So you have to have strong muscle tissue. What did I say last week? In order to develop muscles and for your muscles to increase in health, you need flavonoids. So it's the same with your heart. Even though they're a different type of muscle, long versus short fibers, flavonoids are essential for muscle development, and they are essential for your heart to grow. So we go right back to the baby, even before birth, you know, the embryo. It's developing heart tissue. I'm always going to harp on flavonoids. Now, I also tell you, I've said many times, You've got to have all the vitamins. You've got to have all your protein. You've got to do a lot of things. You got to have a lot of stuff in your diet, and you've got to exercise, and you've got to be careful of what you eat. But I harp on flavonoids because it's such a neglected area that people just don't seem to understand how essential they are for life. So those colored parts of your fruits and vegetables, and in the case of apples, often it's the part you peel off and then put it in a pie and add a bunch of sugar and flour on top of it, and you think it's something healthy. That's graveyard food right there. No, you ought to just peel the apple and just eat the peel and throw the apple away. That red part, that dark part, the dark berries, the darker the better. Those are the flavonoids. Flavonoids. I reminded you that flavonoid actually doesn't mean flavor. It actually in Latin means colored. So the colored parts of the fruits and vegetables, they help you build your heart. So immediately from conception, you've got to have flavonoids, and you get that from the mother. Flavonoids do cross the placenta, just like they cross the blood-brain barrier. We didn't used to think anything crossed these two, but the placenta barrier and the blood-brain barrier are almost identical. Flavonoids cross the placental barrier and help that heart develop. All right, so now it's a muscle. Okay, number two, it is on an automatic neurological system. What again did we talk about last week? Flavonoids are essential for your neurons to develop. So you've got this muscle that's got to develop, and you've got the nerve tissue, especially in the case of the heart. It's on automatic, you don't train it or anything. It's on automatic. It's got to have those flavonoids available so it can communicate with your nervous system to be able to continue to be healthy. All right, what's next? What about that circulatory system? All those capillaries that are going next to your stomach, and then they're all throughout every part of your body. I find it's a misconception because of people's experience. If you cut yourself with a knife by accident or have some big wound, you bleed, and people think that inside the body we're just filled with blood. No, this is not the case. If you cut like a surgeon cuts you, and you avoid some of these vessels, you look inside the body, it's moist, but there's no blood. Did you know that? There's no blood inside you. It's all inside the vessels, the capillaries, the arteries. There's no blood inside you. If you cut yourself, there's going to be a little bleeding there from you cut the capillary. But if you could look inside, it'd be nice and moist, but there is no blood. Any hunter that has skinned out an animal can tell you that. There's nothing going on in there. So it's critical that these capillaries, which carry everything, the raw products you need for life and the waste products that you produce to get rid out of your body, they've got to go through these capillaries. They must be extremely flexible and permeable. So they themselves, you can almost think about them as breathing. Well, if we like to talk about the heart and the vessels, the arteries. We give these names just for descriptions. An artery is a tube that supplies blood coming from the heart, but it's actually all the same organ. You've got cells in the heart. They turn into what we call arteries. Eventually they go into capillaries, and then they come back through the veins. And we just call them veins because it's return flow. There's no difference. It's all one system, and that must be very permeable and very flexible for this whole system to work. Not only because you need to be exchanging these raw products and waste products easily, oxygen in, CO2 out, get rid of poisons. They've got to be moved. They've got to get out, move down the line. Not only that, and all the vitamins and things, permeability. Is it critical? Well, I will tell you that when we first discovered flavonoids, they were thought to be the vitamin that controls permeability of your capillaries. And the first scientists back in the 40s found out that if people did not have enough flavonoids, their capillaries seemed to get very rigid and they couldn't exchange these nutrients. And this group of researchers proposed to the international health authorities, actually the precursor to the World Health Organization, this needs to be a new vitamin, and it needs to be called vitamin P for permeability. So flavonoids were, even though I said flavonoids should be a vitamin, long before I did it, some Russian scientists came out and said, hey, flavonoids are a vitamin necessary for your life. They should be called vitamin P for permeability. So if you look at the capillaries as part of the heart, and it's got to be permeable to exchange all that, you need flavonoids, vitamin P. And I said, not just because of the exchange. So what happens if you don't have flexibility and you don't have permeability? I wish I was in a classroom and I could call on people to say, okay, who's got an idea? Oh, so I'll just answer for you. Constriction, no flexibility, no permeability. What do you think is going to happen to your blood pressure as your heart's pumping? Boom, your blood pressure goes through the roof. That is one of the first things that people that have heart condition, when they start taking flavonoids, their blood pressure drops. And they think it's because, oh, I'm calm. You know, flavonoids made me calm and my blood pressure. No, it made your capillaries more flexible and then your blood pressure drops. That's why if you are already on a blood pressure medicine to lower your blood pressure, or trying to thin your blood, this is really a stupid concept, by the way. I'll argue with any doctor out there or health authority. You're on blood thinners and medicine to lower your blood pressure when the problem is you just don't have enough flavonoids. So you're pushing this blood through a rigid system and your heart's beating. And your whole system needs to flow with that. Can you get this picture, Jackie? Just shake your head. You've got to have that flexibility. It's a beautiful system, but what if it just won't move? Your heart's trying to pump through that. So number one, flavonoids. Okay, I told you, you've got to have them for heart muscle development. We talked about that last week. You've got to have them to have this permeability for exchange, and you've got to have them for flexibility. And if you take those flavonoids, your blood pressure will drop. So my warning is, don't just take a bunch of flavonoids if you're on some blood thinners and heart medication, because you could actually, as you get healthy, you won't need those medicines. That's why we advise you, talk to your health professional, let them know what you're doing, because you could return to health and now you're on medicine that you didn't ever need. All right, let's go into the last area. And I see it's already 7:51. I'm trying to get through. You can tell I get so excited over these calls that I can go on for an hour or two, but I'm trying to stay within half an hour. So have you ever heard of pericarditis? Itis, perio. That is the tissue, the sac that surrounds the heart. This is one of the number one problems. It's not the number one, it's like the number two. Inflammation of that sac. It's a protective sac that surrounds your heart. Itis. Does anybody know about flavonoids and itises? Yes, inflammation. Now, it can happen because you have bacteria, and it's possible. That's one of the reasons. But generally, you get that itis in there because it's long-term, not treated. It's a chronic itis. It's one of those chronic inflammations. You knock out the bacteria, but you still have that inflammation. And because you usually when people have that condition, it's been years not diagnosed. And then all of a sudden, they eventually have chest pain. They've been years. There's damage already done. So then they go in, they get some antibiotics to get it under control, but your inflammatory immune system is whacked out by this time. You've gone into chronic inflammation. And a flavonoid, as I said, is an inflammation and immune system manager. It supports your body health. And without the flavonoids in your diet, you're going to have a struggle to get yourself out of that heart inflammation and back to normal. Okay, the last part of heart health, and there are lots more, but I'm just trying to touch on the top 5. Heart attacks. What is a heart attack? We talk about them. I don't think people actually know what a heart attack is. It's because you get that pump is going, and all of a sudden, not only do you not have flexible vessels in your body, that's bad by itself, but any type of blockage, actually it explodes your heart and it can't pump and it gets into a convulsion and you die. It's real simple because you've got to have oxygen to your brain. So what do? Well, you go into a heart attack and you get to the hospital and they, with electric equipment and some nitroglycerin, and they can keep your heart pumping. And then they say, oh, you've got an artery blocked. So we're going to just take another artery out of your leg and we're going to patch it in and we're actually going to graft it over the blockage. And you've heard, so I had, triple bypass surgery. That's incredible that you ever got in that position. I'll tell you right now, if you had a good diet and you exercise, you will never have a heart attack. If you diet, exercise, you will never have a heart attack. Well, what causes these blockages? Cholesterol. Okay, I encourage people to get back into my previous talks about cholesterol, but just a short note about it is cholesterol is like a bandage inside your arteries. There's inflammation, an unknown source of inflammation in your arterial system. Cholesterol is sent out as a bandage, and if nothing happens, it keeps more bandage and more bandage. It actually goes in underneath the arterial wall. It doesn't just get on top of it, and then it slowly expands. Cholesterol is a bandage. So let me repeat that. It's not the cause of the problem. And eventually it gets swelled until it just blocks off your artery, and then your pump just goes into a jam, just like you ran into a wall, and then it starts in fibrillation. Boom. If you're not treated in a few minutes, you're dead. So, okay, what are we going to do? Well, let's take a piece of your artery out and graft it over that area. Look, you've got inflammation somewhere in your body. I don't know what it's caused from. It could be from a poison. It could be from many different reasons. But flavonoids manage inflammation. And if you take enough flavonoids, if you have enough, your cholesterol level is going to drop. The so-called bad cholesterol. It's not bad cholesterol. It's there for a reason. Also, go back to my talk on cholesterol. You don't get it from diet. That, in fact, every government, the Europeans and the US and Australia, Chinese, have completely eliminated cholesterol recommendations in the diet because they said there's no correlation between cholesterol. Remember the egg scare? Don't eat eggs, got cholesterol. It was nonsense. There's no correlation between dietary cholesterol and cholesterol in your blood, the bad cholesterol. And where does that bad cholesterol come from? It's a bandage trying to heal over the inflammatory sores you've got inside your body. Okay, so there you have it. That's the top. I could go on 2 or 3 more hours, but I want to go back and say that flavonoids, and of course, other vitamins and protein, but I focus on flavonoids because they're neglected. They help you build the heart muscle. Secondarily, they help you structure your nerves around when your heart is developing. The next thing is, and they keep your heart beating properly. And then they also cause your whole system be permeable so you can exchange all that stuff. That also at the same time is against that beat of your heart. They also, not just for exchange, but to be flexible to take that beat. And then lastly is you won't have a heart attack. Almost next last is the inflammation of that tissue around your heart. If you have flavonoids, that will dramatically help manage that. And the last is heart attacks. You should not have any cholesterol with good exercise and diet.
Wow. Dr. Ahrens, all I can say is wow. Phenomenal information. I've got a couple of questions that I want to clarify, but thank you so much because it just explains an awful lot. But two things I wanted to ask you, just to clear up for people. Can we just revisit using flavonoids and blood pressure? Because I know someone's going to come back and say, does that mean that I should not be using flavonoids if I've got blood pressure? So can you please just clear that up a little bit for us, please?
Okay, so I will go back to say that if you have a good diet and exercise, you probably don't need any of these drugs. You take drugs to lower your blood pressure. You take drugs for a lot of different reasons, but often you take blood thinners and you to manage the heartbeat. But if you had a good diet, you wouldn't need those anyhow, because your blood is too thick because you don't have enough quercetin in your body. Quercetin helps your platelets in your blood from sticking together. And so if you had enough quercetin in there, they'd be naturally open and flowing freely. But you don't eat the right stuff. So your blood jams up. And so then the doctor gives you medicine to make them artificially fluid. Well, if you are taking a drug to make yourself have thinner blood, then you take some flavonoids like quercetin, and it makes it, now you're too thin. So I cannot be anybody's physician. So I can't tell you, get off your drugs. I'm not going to tell you to take flavonoids. Talk to your doctor about it. Maybe you ought to try some flavonoids, and then as your blood gets more naturally thinner where it should be, then you would need less drugs. I'm not suggesting anybody to get off any drugs for sure. No, but I think if you had a good diet to begin with, you wouldn't need any blood thinners. Why is your blood thick anyhow? Think about that. Why are you going around with thick blood? Something's wrong. And you didn't get thick blood by watching too much telly. No, you got thick blood because you don't have a good diet.
Well, I guess really this is creating the awareness, Dr. Ahrens, and what I'm getting from this is that it is okay to take flavonoids if you have blood pressure or blood pressure issues. And what you may find is that as the flavonoids support your body, that you may have some changes that you can discuss with your physician. Is that correct?
Yeah. If you did have some blood or any type of heart medication, yeah, why don't you just start out taking some flavonoids, a few of them, I don't know, 100 mils, 200 mils. It's not going to just overnight have a change, but you'll tell your doctor, your physician, what you're doing, and take some flavonoid. And I say, you know what? I have developed several flavonoid formulas, but flavonoids in general are great. I don't care. Go into the health store, get citrus spot flavonoids, anything you want. Take some of these flavonoids and work with your doctor, and then he'll see that, hey, your blood's thinner, or your blood pressure's going down better, and then he'll probably cut back on your medication. But yes, I absolutely say everyone should be on these flavonoids, but just don't start taking 1,000 milligrams, 2,000 milligrams, and you're going to heal yourself. Don't do that. Work in conjunction with your physician. So if you are going to do that, he can then you increase the flavonoids, and he'll work with you to decrease the artificial drugs. So they are safe. As I've always recommend, makes changes slowly over some days and weeks.
So you have answered that, and I think that's really a good lesson for people to realize that we are what we eat. So if we fuel ourselves with optimum fuel, then our body is going to be very grateful and thankful for it. So it certainly makes a huge difference. I've got one more question I just wanted to ask you, was that because sometimes it's asked, what is a blood cycle, and why do doctors ask us to go and have tests every blood cycle, so every 3 months? So what is the relationship between that and our heart, and is there a relationship to it?
Well, you might remember I have recommended everyone get tested at least one. Most people never get any kind of test at all, but I myself get tested twice a year. I want to know what's going on in my body, and these tests are just totally neutral. They're just the numbers, what's inside your body. And also the heart test, especially as you get a little older, to challenge your heart to see how it performs. I will go back, man, with exercise. You guys, you need to do cardio. You need to push yourself. You need to hit that 140 beats per minute every now and then. And it's certainly get yourself up to 120. Hey, don't do that tomorrow morning. That wouldn't be very good if you're not used to it. Okay, I got some stories over that. But you work on it, and then you get to 140, and there's a whole calculation on that. But get your heart tested, stressed, and get your blood chemistry done. Let yourself know where you are, especially as you get past 40 and 60 and 80 or whatever. You can change dramatically over a year. And I promote those doctors that promote these tests, that because you absolutely can change even within 3 months. So get your numbers. It's not expensive. Come on, even in the U.S. where they say how horrible healthcare is here, it's $100 every quarter. Man, you get so much information.
I guess it's the old saying, isn't it? Invest time in your health before your health invests all of your time, because good health costs less than bad, that's for sure. But until you're in that situation, I don't think it really is it doesn't really sing home to you. Dr. Ahrens, you've really given us a lot of information. I want to thank you, because it is, if people aren't already aware, the heart is a muscle. We need to exercise that muscle, so get mobile, do some exercise, fuel your body with good food as well, and get the rest that it needs. Again, you're looking after most important muscle in your body. And I do want to really thank you, because we can take this away and share with people the importance of what we're fueling our bodies with, but understanding how the heart actually functions as a muscle itself, and the most important one that we have. So is there anything that you'd like to finish up with before we go today?
Yeah, I would. You just said it. The heart is the most important muscle in our body, and it's probably the most neglected, because it does not complain until right before death. Think about that. You get your calf, you get a sprain, or some other place, you get a torn muscle, and I got to go to the doctor, and you work it out, and you do massages, and and you take it. Oh, I hurt myself. So then you take it easy. The heart doesn't do that. When it gives you that pain, whoa, it's too late. So it's not like it gives you a pre-warning where, okay, look out, look out. And even when you get shortness of breath, that's due to your heart more than your lungs. And we say, oh, that's our lungs. No, it's your heart. So it is the most important muscle. And it does not give you any warning signs. It just goes every day. It just goes and goes. So I suggest that you do it now. Exercise, do cardio, I mean, come on, real cardio. So you're sitting there on the couch or wherever you are, and your heartbeat's probably, if you're sitting on the couch, it's probably 70 or 80 because you're not in good health. If it was great health and you sat on the couch, you'd go down to 30 or 40. But you're sitting on the couch, it's 80 or 90, and you get up and it goes to 100, and then you just lay back down, it goes to 110 and it calms down. So you need to do just a little cardio and do a little bit more the next day, and just a little bit more the next day. And then you'll find yourself being able to get in that 120. And then when you can finally hit that 140, man, it's exhilarating. It's a pain in the ass getting there, I'll tell you. It sure is. But when you start hitting that 140 and pump it out for like 10 minutes and you go back down, your heart is just loving it and you will live longer. Number two, eat a proper diet, have fruits and vegetables, the dark stuff. And if you can't get enough in your diet, supplement yourself with these flavonoids.
Heart health, Dr. Ahrens, is what I'd like to say. So again, I want to thank each and everyone, but primarily I want to thank our very good friend, Dr. Ahrens, for sharing a really important topic today with Health Talks 365, talking about the heart today. We do want to thank you, each and every one of you, for joining us today. And again, anything that you have heard today, we're not aiming to cure, heal, or mitigate anything. And if you do need to seek any advice, please go to your own physician. This is merely Dr. Ahrens' opinion, and hopefully it creates an awareness and also gives you some information to add to your books into your library of knowledge, because this is what he is doing. He's sharing his knowledge that hopefully opens up quite a few areas for you to understand the importance of looking after your body, getting mobile, getting good rest, and fueling your body with some really good quality food, and the importance of flavonoids. So I want to actually say to everybody, on behalf of myself and Dr. Ahrens as well, have a great Easter, have a blessed Easter, celebrate everything that it means to you personally. And I hope you do get to enjoy the time off if you are able to do that. And we look forward to seeing you next week with another topic. So thank you so much, everybody. And thank you, Dr. Ahrens.
Happy Easter. Bye-bye.
Bye.